I'm in no panic. I'm not lonely.
Bill Chadwick makes coming to the Kerby Center a regular part of his routine.
The breakfast, I love the breakfast here. Well, like, I'm a food guy. You want to make me happy? Feed me.
He's
Lift it
active and
off the
connected
glass.
and likes a good conversation and makes time for friends and nephews and
Toast
nieces.
is good. I like the rapport. I like, chatter. Oh, yeah, I like being around. Like, that's why I like hanging around with kids. Jesus, they're the best. If you want to be young, be 11. you know?
Bill's experience reflects what researchers say protects against loneliness. A new Alberta study suggests that while loneliness amongst older adults has eased since the pandemic, it's far from over. Researchers say the answer isn't simply offering more activities, it's helping seniors build meaningful relationships where they feel they truly matter.
It's not just having opportunities to interact with people that's important for loneliness. It's often much more the quality of the social relationships, the quality of the social interactions. Especially our research suggests what's known as mattering, feeling like you matter to others in your lives and they matter to you.
In this story, we explore what makes a meaningful connection and, more importantly, how do we get them?
I get a good night's sleep. Active all day. I like to cook, do my own thing. I got buddies that I haven't seen in 30 years. And I know for a fact there'd be 10 minutes of uncomfortable. We'd be right back where we were, you know?
There's been a lot of discussion, especially during the COVID-19 pandemic and after, as to whether older adults, especially in Canada, are experiencing an epidemic of loneliness. And there's then this question of, has there been a recovery following the COVID-19 pandemic? And I think it's still really an open question because even if loneliness is better among Albertan older adults that is less common, what we still see is fairly common experiences of loneliness. So I think it's an open question as to whether we can say the epidemic's over. Maybe possibly not at the height that we saw in the COVID-19 pandemic, but I don't think we can at the same time say that's it, we can cancel the cause conference of concern.
What surprised you the most when you were comparing, I think it was the 2022 to
Mhm.
2026, was it?
Absolutely,
Data, yeah,
yes.
what was it that surprised you?
I don't know if there were any really big surprises. I think probably what I would not have necessarily predicted ahead of time was just how common some of these markers of loneliness remain. So, what we did was we asked people about three common markers of loneliness. The idea is that there could be a certain stigma to just saying, oh, I'm lonely. So instead of directly asking this, what researchers across the world do is they often ask about these three markers. That is, do you feel isolated? Do you feel left out? And do you feel like you lacked companionship? And what probably was most unexpected to me was especially the measure of felt isolated. About one in three older adults in Alberta reported feeling isolated. And then one in four about indicated feeling left out and lacking companionship. So what really surprised me was it's not just so much that, yes, these markers decreased in terms of how common they are, but they seem to be somewhat resistant to change.
What's the difference between lacking companionship and, say, feeling left out?
Mhm. That's a good question. We don't actually define that for our audience, so there's a certain subjectivity to that. But in general, you can think about companionship as somebody who's very close to you, who you feel gives you a lot of support, a lot of value. Something like feeling left out means I don't feel like I'm part of a group or part of a community.
Why do you think feelings of isolation and exclusion have been slower to improve than companionship? Is that correct from the studies?
Yeah, that is absolutely correct. Well, what's interesting is you're absolutely correct. Companionship definitely had the most improvement. But what happened was companionship ended up at about the same point where feeling left out is, with actually feeling isolated a little bit higher. So what happened was coming out of the pandemic in 2022, people were really feeling like they were lacking companionship. So what we're seeing essentially is this: people now feel like they have people in their lives. They feel like they have a companion to be around them, but they still definitely feeling isolated and feeling left out and feeling like they lack in companionship as well. So what we're seeing here is essentially across the board now, these three indicators seem to have a bedrock where we're not able to move the needle on them.
Why?
Why? That's a good question. We don't exactly have an answer as to why we seem to have this bedrock of loneliness among Albertan older adults, but we speculate this. There was a lot of attention coming out of the pandemic to increasing community events, increasing interactions for older adults. But what our research shows is that it's not just having opportunities to interact with people that's important for loneliness. It's often much more the quality of the social relationships, the quality of the social interactions. Especially our research suggests what's known as mattering, feeling like you matter to others in your lives and they matter to you. And so, what we suggest is this. People may have regained a certain amount of social contact coming out of the pandemic, but they're still lacking in this high quality of social relationships that will further reduce loneliness. What seems to be needed not just is opportunities for older adults to interact with each other and more broadly members of the community, but instead opportunities to have ongoing quality interactions where they really feel like they matter to others.
So I take it then it is possible for someone to be surrounded by people and still feel lonely.
Oh, absolutely. Feeling lonely in a crowd is definitely something that can happen to us all. Without question, that is a could be a big part of what we're seeing, where older adults may still feel like they have opportunities to interact with people and to have social events, but do they feel like they matter to others and others matter to them in their lives? That's a bigger question.
Was the data able to tell you something about the lasting impacts of the pandemic then on seniors?
Well, only to the extent that we talk about in this research, which is it does appear that there has been some recovery of loneliness, but not to the extent that we would really hope.
Okay. And what should Albertans then be taking away from these findings?
I think especially we all need to make more efforts to not just include seniors in our lives in a more quality way, but also try to engage seniors in terms of our lives. One of the things that we know about mattering is this. Mattering is often about how much you feel like others depend on you. So engaging with older adults and bringing them into your own life often is a way to really just brighten up their lives and really strongly decrease the sense of loneliness.
Do you have any suggestions for that to make people feel like they have a role or that they're being dependent on?
I mean, it depends on the older adult that we're talking about, what they're able to do. But I think often giving people a sense of self-efficacy in others' lives can really do that. If you can somehow help older adults, not to burden them, but to help them feel like they're doing something for you in your own life, something that they feel like they're contributing. That's where that sense of mattering can come in.
Does volunteering play that role, or are there other
It,
that comes to mind automatically, but there are other
Yeah,
things?
absolutely. I could, but what's really important with mattering, I think, is these ongoing social relationships where we feel like we have this quality of social connections to others. So can mattering contribute to that? 100%. But I'm talking about much more on an interpersonal basis. For the older adults who may be in your lives, does it mean that bringing them in and having them when you're preparing some family meal, having them have a part of that? Does it mean providing some sort of role in a grandchild's life? All of these things could be possible. I think also we don't want to overburden an older adult, but having them feel like they're efficacious and contributing to the lives of others is one important way of feeling like you matter.
Yeah, there's almost kind of like these two separate groups of seniors, ones that are being so much work is being downloaded on them. They're basically taking care of grandchildren or they're being, dumped on. And
Mhm.
then ones who have no family and don't have anyone relying on them.
Yeah, absolutely. It's interesting we talk about this because in a previous study we did on a sample of about 50,000 Canadian older adults, we looked at what we called caregiving burdens, which essentially number of caregiving activities that you performed for others, going from zero up to about eight, I believe. And what we actually found there was there's a sweet spot that actually there could be a benefit to performing some caregiving for others, but then that benefit actually turned detrimental at higher levels of how many caregiving activities you were taking. So at a slower number, you feel like you matter to others. There's a reward to providing that sort of benefit to others. It's when you overburden people and really just have people to perform a lot of activities. That's when you can have that negative effect on mental health.
And then it's just overwhelming.
Absolutely, exactly.
Yeah. Are there particular groups of seniors that are more vulnerable to loneliness?
Um, we didn't look at that in this research, but something that our previous research shows is financial insecurity has a substantial impact on loneliness. When older adults are more so substantial, or more, sorry, when older adults are more financially insecure, especially in terms of financial strain, in terms of trouble paying the bills, making ends meet, that's often when they're much, much more highly at risk for loneliness.
hmm and if policymakers could do, say, one thing tomorrow to reduce loneliness amongst older adults, what would you recommend?
I'd actually recommend two things. I know you asked for one, but I'd like to do two
Go
because
for it.
it's one thing I think that older adults really need is, especially at the lower end of the economic scale, they need more support. We know that financial strain is a huge predictor of loneliness. And I think more support, especially when older adults are financially struggling, will help remedy loneliness. Outside of that, I think we need more support for activities that really create this ongoing sense of social bonds and quality of social relationships, not just an activity where people are able to get out of the house, but where they're really able to connect with others.
What's the difference then between, someone coming in, say here, and they're, say, taking a fitness class
Mhm.
or learning Spanish or
Mhm.
the many things we learn here. What's the difference between doing that and still feeling lonely and not feeling that real connection you were talking about? How can we ensure that part?
When we talk about, taking a fitness class or learning Spanish, that's exactly what we're talking about when you could be lonely in a crowd. Sure, you can go in there and, do jazzercise or whatever, but you're really interacting with someone in a way that lets you feel like you're mattering in their lives. I think creating these kinds of opportunities and spaces for people to interact and share their lives and talk about what's going on is, I think, absolutely essential for creating this sense of mattering.
Yeah, almost like getting some like intergenerational um roles, activities happening where, both people can benefit. Is that something you've looked at?
We have not looked at that, but
hmm
absolutely, intergenerational activities could be absolutely
hmm
key because, especially, you may feel like you matter more when somebody of a different generation of yours is involved in your lives, and you feel like you are important to them. Absolutely.
hmm And have you looked at how big of a role transportation plays in this too? I mean, you can have all the activities in the world, but if someone's either can't or won't get to them, it's a big deal too, right?
Absolutely. We haven't directly looked at that, but that's part of why we believe that financial strain can have such a
Mm.
negative impact on people's loneliness because it's even if, say, an event is free, it can still cost something on a monetary basis to be able to get there, and that can limit people's social abilities as well.
You have so much great information on this. I'm just curious, Alex, what was it that drew you to studying loneliness and aging?
Well, it's I kind of backed into it, quite frankly, about 2018 before the pandemic. I just started reading some research on loneliness and started thinking, this may be really important, but long before that, what I was studying was stressors among older adults. And I got into that simply because I started working with someone who was absolutely brilliant at the University of Maryland when I was doing graduate work, who was studying stress among older adults. And so as I slowly started to look at stress among older adults and then look at loneliness, I really started to focus on economic marginalization. How essentially do economic stressors and economic problems among older adults lead to not just to loneliness, but feeling like you matter less, to feeling like you matter less to Canadian society. And so that's really where I focus is bringing the idea that loneliness and these other outcomes aren't just an individual problem. They're a societal problem because when society sets up an economic system where there are winners and losers, being a loser in this economic system will have negative repercussions for how much people feel like they're a part of society.